Good evening, I'm Adrienne Arsenault. Tonight, just how bad might COVID-19 get? Canadians want to know what the government knows.
We'll have more information coming to you with it soon.
But Ontario's premier says he'll tell all tomorrow.
People will see some really stark figures tomorrow.
I'm Andrew Chang. Also tonight, drastic changes in crucial Canadian job sectors, from truck drivers to health workers.
We're told that equipment is coming, but it never really arrives.
A chorus of tough words from community leaders aimed at you if you're not staying home.
And our doctors answer your questions.
We want to make sure that we maintain the integrity of the mask.
Plus, Rosie's here with At Issue. This is The National.
The terrifying and tragic proportions of the COVID-19 pandemic are often summed up with numbers. Tonight, we begin with two of them. Coronavirus cases worldwide have passed the 1 million mark.
And more than 10,000 of those are here in Canada. 1,550 new cases today, most once again in Ontario and Quebec, bringing Canada's total to more than 11,200. But just remember, these numbers are an incomplete snapshot. Leaders who've seen the best available guesses on where this country is headed were blunt today.
Everything that we are going to face will be directly linked to how people behave today.
This is a critical week in our fight against the coronavirus.
A critical week when the national curve seems far from flat and Canadians far from safe. With more than 165 Canadians having already died, there is rising pressure on the government to reveal its projections, how much worse it thinks COVID-19 will get. Catherine Cullen shows us the response.
We are maybe starting to bend a little bit here.
British Columbia went deep with its data last week
to help us plot a course that we can all get around and understand.
Tuesday, the White House went even further, projecting between 100,000 and 240,000 deaths over the course of the pandemic, if people stick to social distancing.
This is where we have the ability to push it down.
Alberta and Quebec say they've got data modeling coming, so where are Canada's national projections for the outbreak?
I think it's only fair that the citizens are completely aware of what the different projections show, so that we can plan ahead and so that there's no surprises. It might wake some people up to really understand how serious this can be.
The Prime Minister acknowledged today Canadians want to see the scenarios the government is looking at.
You want to prepare for the worst. You want to know what to be hopeful about. I know.
But can't quite say when that will happen.
Soon.
Because officials say this has a lot of moving parts.
We need accurate data, and the provinces and territories have been working really hard to get to a place where they can provide us with that.
There are specific concerns about Ontario ramping up its testing, but that province is coming forward with projections, not just soon, but tomorrow.
No matter how tough the message is going to be tomorrow, it's the fair thing to do to people in Ontario. They have to know where we stand.
Though the U.S. is a reminder that models can change. The day after its announcement, it increased its projection by thousands of deaths. New numbers in this country could be sobering. The hope is that it will convince Canadians to do their best to stay safe. Catherine Cullen, CBC News, Ottawa.
So, Ontario's premier did warn today that some of the projections he will unveil tomorrow are stark. As Chris Glover shows us, his province is playing catch-up.
COVID-19 testing in Ontario is alarming Canada's chief scientist.
I have to say that I am a little bit preoccupied by the situation in Ontario, because we should be doing more testing in Ontario, and I hope that they're going to be able to ramp this up.
Provincial health officials admit the nearly 2,800 confirmed cases don't capture the true scale of the outbreak.
We know that this is an underrepresentation of the numbers.
While some provinces like Manitoba have eliminated testing backlogs, Ontario has some 2,000 tests awaiting results. But roughly 4,800 were pushed through in the past day. And Ontario's chief doctor says they'll be caught up in short order.
We were concerned about it, we're working on it, and we said we would bring it down this week, and we've done that.
The focus now is further testing of all sick people and their close contacts. The next major struggle will be patients flooding intensive care units. COVID patients in Ontario ICUs keep doubling every 4 days, now at 167 patients. At that rate, they'll overwhelm Ontario's roughly 400 open ICU beds sometime next week. So it's been a scramble to build this makeshift hospital in Burlington, just west of Toronto, to house 93 patients and take expected pressure off the nearby hospital. And with the looming surge, premiers are meeting tonight, restricting interprovincial travel and mandatory stay-home orders, all possible, says the Ontario Premier.
Everything is on the table right now.
Looking at officers stopping drivers, even cyclists crossing the provincial border between Ottawa and Gatineau, a sign of just how extreme things already are and where they may be going from here. Chris Glover, CBC News, Toronto.
COVID-19 caused more pain in seniors' facilities today, deaths in places that have already seen residents succumb, and in homes that hadn't until today. David Common looks at why it's so hard to contain this virus once it enters and why there might be help and hope on the way.
With 2 more deaths today, the horror in Bobcaygeon is far from over. 1 in 4 residents here now dead, with more across Quebec, Alberta, British Columbia, and 3 just this morning at this Toronto home. More than half of those left alive are now showing symptoms.
It's a very large portion of our population in nursing homes, and we are preparing for it to sweep right through the nursing home.
Care in these homes involves a lot of touching, and once COVID is introduced, says the U.S. CDC, rapid transmission can occur. Not good then to see hundreds of homes across Canada reporting new cases. The situation so grave in the U.S., Disney is shipping rain ponchos from its parks to healthcare workers without gowns, while care home staff in New York are being issued 1 mask per week.
We're in a way different place than we were a few days ago. It's actually worse than it was.
In Ontario, the wave is coming, but so is help. 700 retired staff returning, and they're told there'll be more protective equipment soon.
We're doing the best we can every day, and what we're hearing from them is they're scared, they're desperate.
Anything will help. As Bobcaygeon revealed, homes could lose half their staff or more to infection. David Common, CBC News, Toronto.
At the sharp edge of this pandemic are the medical workers, and a grateful nation sends out thank yous to them all the time. Those are surely appreciated, but good wishes can't keep them safe. So Thomas Degler looks at the effort to keep those in healthcare healthy.
This is just a start. Volunteers are sifting through donated face masks destined for Toronto area hospitals. They've received 30,000, but they're asking for 3 million.
It's a huge number, but is that enough?
I don't even think 3 million is sufficient to get through the pandemic. 3 million is probably only sufficient for the first several weeks at most.
And don't forget, that's just for the Toronto area. In regions across the country, healthcare workers are concerned personal protective equipment may run out when the coronavirus surge strikes.
We understand from our colleagues in both Italy and New York City that it's not a gentle ebb and flow. Suddenly they just appear on your door and you're overwhelmed.
Quebec says it only has enough PPE for another week, while some Ontario nursing homes may run out in just a day or two, says this union leader.
Safety measures in place in the facilities are inadequate. We're told that equipment is coming, but it never really arrives.
Consider what happened at this Winnipeg hospital, deprived of dozens of staff all at once, sent home for fear they were exposed to the virus.
If we had improved
or started the PPE earlier, we may not be seeing the amount that we're seeing right now with nurses off work.
Despite unprecedented demand around the world, Canada just got another plane load of masks, among more than 10 million received this week. The government is urging provinces to coordinate their orders through Ottawa to avoid bidding wars and competition.
We've contracted services for domestic distribution through Amazon and other providers, and that will help make sure things can get to places very quickly.
On the front line, though, it's an agonizing wait, knowing a risk to medical staff means a greater risk for everyone. Thomas Daigle, CBC News, Toronto.
So today, New Brunswick announced schools will not reopen this school year. Montreal is moving to limit visitors to condo buildings, and restrictions on other gatherings, they really do vary from province to province. But on the main point, everyone agrees.
Please stay home. Stay home.
Stay at home. Staying at home, staying apart with each other.
Most important message, stay home.
The less people are in contact with each other, the less the virus should spread. Tina Lovegreen shows us some of the ways that message is being drilled home across the country.
This is what authorities want to stop. People ignoring physical distancing rules. And right now, getting too close means getting in trouble.
A call came into 311 about a backyard party of 20 people who have showed complete disregard.
Earlier that day, the mayor of Brampton passed a new bylaw. Anyone in violation could be fined $500 to $100,000.
This is too serious for anyone to be reckless and foolish.
In Ottawa, over 130 calls came in just one day.
A birthday party for kids with 20 people in the backyard. Someone had a garage sale.
Some provinces like Alberta and Newfoundland even have a dedicated website to report violations. A special COVID-19 police unit in Newfoundland arrested a woman twice for not self-isolating after travel.
The woman was non-compliant and had no intention of cooperating.
Most municipalities are focused on education. Park rangers in Vancouver are patrolling hotspots.
Hey guys, how's it going?
They can't issue tickets, but have given over 1,000 warnings.
It's definitely a challenge, particularly when, like I said, the sun comes out, and we've been dealing with nighttime beach fires, for example. We had 3 last weekend.
Sports fields, playgrounds, and parking lots have already been closed off, but more shutdowns could be in the works if people keep breaking the rules. Tina Lovegreen, CBC News, Vancouver.
Thousands of Canadian travelers remain stranded abroad, and government resources seem overwhelmed when it comes to helping them. Now, an Alberta couple has stepped up. They are part of a Facebook page to identify Canadians stuck in Peru, just like they were, and to tell the government who should be prioritized. Jonathan Gatehouse shows us the result.
So here we go. Oh, Canada.
The competition to get on a flight out of Peru is fierce, but emergency physician Ekaterina Turco is finally on her way home to Vancouver.
So we are on the bus now, and there are approximately 50 people on this bus.
After a long, frustrating effort to secure a seat on a Canadian government-organized charter flight.
Trying to book a ticket over and over and over and over again and not being successful, you do feel like they are not really helping. And I think that's a lot of kind of anger and disappointment and feeling of abandonment by the government.
Those who started to get flights did as they were told, like being hosed down as they left their hotels. Becky and Billy Fidlin managed to get out last week and resolved they would help those still left behind, using a Facebook group to help identify the most vulnerable.
I realized that maybe, things are getting really serious, and a strong voice always comes with a large amount of people who are in the same predicament.
But they also wanted to get Dr. Turco on the priority list because she was urgently needed back home.
Because I'm an emergency physician, they felt like my place is actually in Canada right now, which I totally agree with. If it wasn't for Becky and Billy, I would still be in Lima.
One person who hasn't yet found a way out is 76-year-old Terry Lloyd.
And how are you with technology?
I'm a bit of a dinosaur.
The retiree says he can't afford the $1,500 for the evacuation flight. But Becky and Billy, now back home in Alberta, are still on the case, trying to help him and hundreds of others who went abroad before the COVID-19 crisis hit.
at this point, it doesn't really matter whose job it's supposed to be. It's just a job that has to get done.
Determined to leave no Canadian behind, the Fidlins remain a lifeline, connected in a way that Ottawa hasn't yet been able to duplicate. Jonathan Gatehouse, CBC News, Toronto.
And after nearly a month at sea, 2 COVID-stricken cruise ships carrying 247 Canadians have now docked in Florida. Anita Bath is following that and other stories from across the country tonight.
Adrian, passengers will undergo health screenings before disembarking tomorrow evening and flying home to Canada. Anyone showing symptoms will stay on board until cleared. The Rotterdam joined the Zaandam at sea last week, taking on more than half its passengers after 4 people died aboard, at least 2 from COVID-19. Florida rejected their requests to dock several times until U.S. President Donald Trump stepped in.
We never thought Mr. Trump would come to our rescue. Like, who would have thought? But, you know, he said the right thing. This is a humanitarian mission now. We have people on the ship that are sick, including Americans. And, you know, it's important to get these people off the ship and get them to medical attention.
And in Quebec, cases continue to surge. As you heard earlier, the Premier says there's a desperate need for equipment. Apparently, lots of people have extra masks and they've been emailing the Premier personally, but not all offers are helpful.
They say, I'm ready to make some mask, but I don't have any material, I don't have any design, I have nothing. I only have people that are ready to work. We're trying to be closer to have people that will be able to deliver the material in the next few weeks.
The Premier's old company, Air Transat, has offered 25,000 masks, but he says millions more are needed. Adrian?
All right, thanks, Anita. CBC News has a team tracking every confirmed case here in Canada. We've put together all that data in a special online interactive. It's worth looking at. So head to cbc.ca/coronavirus tracker. Canada's border with the United States has been closed for almost 2 weeks now, and while there are no limits on commercial goods entering this country, new numbers show a drop in truck traffic. Specifically, 24% less last week than over the same time in 2019. In a typical week, trucks move goods worth more than $8 billion. But COVID-19 isn't just taking a toll on the trade in goods. As Carolyn Dunn explains, life for the drivers is getting harder too.
This is the supply chain at work, and this is the supply chain not working well at all. Truckers turned away in their moment of need. Driver Paul McDonald says it can make a long haul really long.
They just won't let you in. So you just can't use their facilities. So you hold it, carry on, pray for the next one.
Alberta temporarily closed its rest stops after people raided them of toilet paper and hand sanitizer, prompting this sharp rebuke.
So we're trusting people just to show some decency in reopening those rest stops. Today, I'm also calling on restaurants to temporarily allow heavy truck and long-haul drivers to walk up to the drive-through window to place their order and allow them access to washrooms.
A welcome plea for Al Adolf, who was recently refused walk-through service at a drive-through in Manitoba.
I went there and they refused to give me a coffee, and I was supposed to phone it in. I said, phone it in, I'm right here.
As news of their plight spreads, solutions for truckers are cropping up. The town of Sydney on Vancouver Island created its own truck stop in an empty parking lot.
You know, there's a lot of unsung heroes that are out there. Truck drivers definitely among them.
Moral support is growing too. This Winnipeg family showed their love to passing truckers on the Trans-Canada Highway.
I would just like to say thank you, and we appreciate you, and you don't go unnoticed.
They're actually seeing that the truckers doing what we need done. Like all these jobs that a lot of people thought were below them are now what's carrying us.
Now to make sure they can get a decent meal and a place to go to the loo. Carolyn Dunn, CBC News, Calgary.
More than 6 million Americans have filed for EI. Up next, what is a health and economic crisis?
the buck stops on his desk.
Due to an already unpredictable presidential race.
Plus, at issue is here. Is the federal government moving fast enough to help Canadians taking the economic hit?
We don't have any income and we have 3 children to feed.
And keeping safe while handling cash. The latest in our COVID-19 how-to series. Next, we're back in 2. Many Americans are now being advised to wear homemade face masks when out in public to prevent the spread of COVID-19. In fact, new CDC guidelines are expected in the coming days. But authorities caution that medical-grade masks need to be reserved for frontline health workers, while many of them, just like those here at home, are expressing fear and anger over a shortage of personal protective equipment.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament. I'm 28 years old.
There are more than 240,000 cases across the United States now, and the crisis has led to what could become the most stunning job market collapse the U.S. has ever seen. Last week, 6.6 million Americans filed for unemployment insurance. And as Susan Ormiston shows us, behind that staggering number is a great deal of hardship and uncertainty.
Show some love sums it up for Gregory, Mary, Sam, who used to work at this DC club. Like millions of other bartenders, cashiers, waiters, who now have no one to serve.
I've had friends that have been laid off completely. I have friends that thought they were secure in their jobs for a while, getting their salary, and then come this week, their employers are cutting their hours, cutting their salary.
Small businesses are shuttered across the U.S. with no guarantee of when or if they'll reopen. Unemployment claims stacking up as online sites clog or crash from too many applications. The economic punch is staggering. 10 million Americans lost their jobs in March, mostly without warning. That wipes out 5 years of job creation in the United States, and the government relief package hasn't come yet.
6 feet apart, one person at a time.
Food banks are straining. Martha's Table used to serve 1,000 people a month. Now it's that many a day.
It's too much. People are really in deep depression, When I talk to a lot of people, they don't even really want to talk.
2 partners at Rasa lost 75% of their business and had to furlough half their staff.
It feels like you're fighting a forest fire and the fire's all around you and you're right in the center and you're just deciding which direction to spray the water.
It's only been like 3 weeks, I think, now, but it's felt like, 3 years because every day it's constantly changing.
Takeout is still happening, and in the middle of the crisis, some charity. They're pumping out hundreds of meals a day for nursing homes and low-income families as they try to plot their uncertain future.
It's hard to make plans because it's not like, okay, after 2 months, everything's going to be back to normal. There's all of these other open questions that are completely unanswerable of what is consumer behavior going to be like at that point.
When will tables be filled and how will everyone get through this? Susan Ormiston, CBC News, Washington.
The COVID-19 pandemic has been so all-consuming, it's pretty easy to forget that in the midst of it all, the United States is driving towards an election 7 months from tomorrow. Paul Hunter looks at how the health crisis is having an impact on politics, too.
It may well be the last thing anyone in America is thinking about right now. To the question, might the corona crisis cancel the November presidential election?
The answer is no.
Not a chance, says Mark Elias, Democratic Party and voting rights lawyer.
That date won't change. A state can't change it. President Trump can't change it. The only way that could change is by act of Congress.
But there are, he says, complications. Think about it. Would you stand in line to vote in the time of corona? And what about finding volunteers needed to staff those busy polling stations on Election Day? Good luck. One solution, a vote by mail. But not all states allow it. Rules vary, and post offices could be overwhelmed. The time to act on all of it, says Elias, is now.
And unless we take affirmative steps to make sure that we can provide safe and well-staffed in-person voting, but also dramatically scale up the ability for voters to vote by mail, we're going to have a real crisis.
Meanwhile, with the primary season in disarray,
the coronavirus is forcing candidates to call off rallies.
Word today, corona concerns will push the Democratic convention from July now to August. And forget about those giant campaign rallies this fall, says Democratic strategist Mark Longabaugh.
I think we may see the first presidential campaign that is all television and all video.
But with the presumed Democratic nominee these days fighting even for airtime,
you know, Donald Trump downplayed the seriousness of this crisis for weeks.
It's as if Trump is already campaigning. He calls those corona briefings a ratings hit. Still, says Longabaugh,
I find it hard to believe that at the end of the day, 6 months, 9 months from now, voters aren't going to believe that this president was in charge and what happened here, you know, the buck stops on his desk.
But the key challenge before that day remains simply finding a way to vote safely. Paul Hunter, CBC News, Washington.
Well, next on The National, sorting out fact from fiction with our panel of doctors. Like, what to make of shifting guidelines on masks? Should you wear one? Should you make one? That's next. But first, COVID-19 has us rethinking simple, everyday actions. We're taking a look at them in our daily how-to segments. And tonight, what's the deal with cash? Money changes hands all the time, but can it carry the coronavirus? The short answer is most likely. A study in the New England Journal of Medicine found that when they tested how well this coronavirus survives on different surfaces, on plastic, which is what Canadian money is made of, the virus stayed viable for days. So someone wipes their nose with their hand, pulls out a 20 to buy some toilet paper, and later that same day you get this 20 back as change. So if you have a choice between cash or credit?
I do think that in the interest of just the anxiety of everybody who's working in our essential stores, our pharmacies, our grocery stores that need to be open, I think it's a kindness to them if we all start using, credit and debit cards.
And either way, after handling anything, remember to wash your hands afterwards. Welcome back. It is time to put some of your COVID-19 questions to the medical experts. Tonight, we are joined by respirologist Dr. Samir Gupta and emergency room physician Dr. Taslim Nimji. Hello to the two of you. And I'll warn you both right now, we have quite a few questions about masks coming your way. So let's get right to them. Number one, Dr. Gupta, this is for you. Canada's Chief Public Health Officer recently put out a series of tweets giving advice about how to use a homemade mask responsibly. Are we doing a 180 on whether masks are beneficial?
I think there is a bit of a 180. The guidance from our public health officials and from the CDC from day one has been that public masking is not effective. I don't think we ever really had enough evidence to either support or refute that, though. And for many countries, as you know, that was part of the playbook for COVID-19. The reality is we do have a shortage of medical grade masks in our hospitals. And that's where I think this role is coming in for cloth masks for the public.
Is the bottom line in your mind that people should be wearing them then?
I think the reality is that we don't have the scientific evidence, but we have enough anecdotal information to sort of draw a line to say that, this is probably reasonably safe if people do it properly. And it probably reduces the risk, particularly because we know there's a lot of asymptomatic transmission of this virus. And we know that cloth masks will probably reduce people's droplets from going out, more so than they protect them from other people's droplets.
Okay, Dr. Nimji, how long is a typical mask good for and why?
So the masks, there's been questions around expiry dates, right? So masks that have expiry dates are generally the N95 masks, not the procedure masks, which are the ones that you're seeing being worn certainly out in the public and worn by our healthcare staff when not doing airborne procedures. And the reason, and no one's really done studies to say, how far past an expiry date can you use a mask? So I couldn't answer that question. I don't think that anybody really can. But we want to make sure that we maintain the integrity of the mask. And so that's why we focus on the N95.
Because how long can you wear it before it stops being effective?
Yeah, so what you want to do is not be wearing it for such a long period of time that you're then being exposed to multiple different people with that same mask. It's the risk of cross-contamination that we worry about. But if you're wearing an N95 over the course of the day during your shift, then that we have nothing to say that that wouldn't be okay and that it wouldn't be safe to wear that. The worry is around touching that mask that might be contaminated on the outside and then touching yourself or someone else.
Dr. Gupta, time for one quick question, quick answer. Should we all cover our mouths and noses when we're out in public, even if it's just with a scarf or a bandana?
I think this comes back to the cloth mask question, and those cloth masks are probably effective at preventing our own droplets from getting out, probably not so effective at blocking other people's droplets. So do it, but then don't let your guard down, still physically distance, still wash your hands.
Dr. Gupta, Dr. Nimji, thanks so much for your time.
Thank you.
Now, as always, we'll be asking and answering your COVID-19 questions every night, so send them in. You can find us directly on Instagram at CBC The National, or send us an email at covid@cbc.ca. Just be sure to put The National in the subject line.
Still ahead on The National, one family's story of just trying to hang on while they're being squeezed from all sides. The economic trouble facing millions of Canadians in tonight's Pandemic Diary next. But first, Rosie and the At Issue gang are here.
Adrian, the federal government is continuing to check in with Canadians on a daily basis, but there is one thing that they aren't being super forthcoming with, at least for now. Coming up, we'll look at the mounting calls for Ottawa to release its own projections. Chantal, Andrew, and Althea will join me right after this break.
I know a lot of people are still wondering when this will get better or how much worse it might become. You want to see the numbers and the predictions, and we'll have more information, keeping coming to you with it soon. But the biggest variable in shaping these projections is you and your behavior.
Ottawa is facing some increased pressure to share more with Canadians about the spread and toll COVID-19 could take in this country. So what more might be coming? It's Thursday, and I'm here with At Issue. They're, of course, joining us from their home studios. Chantal Hébert is in Montreal, Andrew Coyne is in Toronto, and Althea Raj is here in Ottawa. Good to see you. So we know Ontario is going to present its own projections tomorrow. Premier Ford has said they are grim, that they could be a wake-up call. BC and Alberta have also shared a certain amount of information. President Trump did this week. I know the federal government is very much reliant on the provinces for the data, but they also do have something. And I'm wondering why it seems like we haven't seen anything beyond the raw data that is available out there. Chantal.
They're not, in part, reliable on the provinces for the data. They are totally reliable on the provinces for the data because it's a strength and a weakness, but we don't have one health system in this country. We have 10 or maybe 12. And every province has been gathering its own data based on how it measures it. And that is where the federal government gets the information. That is not to say that the federal government does not have models that say if it gets like this, it's going to take this, and if it gets like that, it's going to be a shorter period. But get this, once they put together all this data, and I believe they will give you projections, it's only going to be as good to project the ending of this as the least great province at getting their curve to not rise, especially if it's a larger province.
Right. So will there be a great deal of benefit to seeing it then, Andrew? Is it still important for Canadians to see?
Yes, I think first of all, as a democratic society, we should never be afraid of more information. I know people are saying, oh, people will misuse it or they'll misunderstand it, but we seem to be able to puzzle through other complicated bits of data. This one's particularly important because we're trying to motivate and mobilize people to do a very hard thing, which is basically to stay in their houses for weeks and months on end. And it is useful, I think, for people to know the dimensions and gravity of the problem. I know that the data on the raw cases isn't necessarily terribly informative because it intersects with how many tests are being performed. The more tests you are, the more cases you might show. And it might not be that the underlying problem has gotten worse, but you've just tested more. But I think it's particularly important for people to see data on hospitalization rates, particularly intensive care usage, because that, of course, is what this whole thing is about, is trying to keep the curve below the level of the hospital capacity. And that's where that kind of number really does give you meaning because, people aren't going to be in the hospital unless they're terribly, terribly sick.
It is challenging, I guess, and maybe that's something that we should have corrected from previous pandemics. But how important do you think it is for the government to put what they have out there, Althea?
Well, I agree with Andrew. I think we are a democratic society, and therefore it's important for the government to be as transparent as it possibly can be. I think there's a hesitancy that there's this sort of fatalism that exists when the numbers come out. Oh, well, maybe tens of thousands of Canadians are projected to succumb to this virus. Does it mean that I need to stay at my house? Maybe it's harder to convince people to stay in their home if they think that the end result is already carved in stone. And I think the communication around the forecast is going to be important. The other thing to remember is that the forecast is not data. It is modeling, and therefore it's just going to give a suggestion about where they think the curve might be and what the total cases may be and what the deaths may be. And it's not going to be actually hard and fast data. And then everybody else has basically pointed out that the information varies across the country, and I think that has been the challenge for the federal government.
Yeah, and it will, of course, vary on our behavior. It is dependent on our behavior right now. I want to do one quick round, if I can, on the economic side, because the government says this is the biggest package, aid package, any government has ever presented with the wage subsidy plan, which is a lot bigger than what was initially put forward. Chantal, what do you make of this huge amount of money they are blowing out into the economy?
I don't think, again, this is not stimulus. It's a help package to get us through this. It probably comes maybe 10 days later than it could have. If the government initially had self-corrected its initial 10% version. That being said, in normal circumstances, rolling out a program like that at this level over 3 to 6 weeks would be considered a miracle. Actually, people would say this is impossible to do. So it's a huge logistical challenge, but I believe that it is important.
Andrew.
It's quite extraordinary. We're seeing tens of billions of dollars going out the door in programs that are being reinvented and redrafted 2 days after they've been released. I don't say that as criticism. I say that this is the nature of the problem that they and we are facing. To try and get this much assistance to so many people in such a short period of time. But it is testing the limits of our system of parliamentary democracy, which is supposed to be about scrutiny and carefully making sure every dollar is carefully spent. I think with the best will in the world, everyone who looks at this knows that massive amounts of this are going to be misspent, but there's just no alternative.
Althea?
Well, the alternative is for Canadians to not take advantage of some of the loopholes, because there are some and they are glaring. So it's $95 billion so far. And the government is really clear that basically they're still adjusting and tweaking the programs and that more is going to be announced in the weeks and perhaps months to come. I think already the problem with some of the things that have been announced is that the gaps are already showing. And sometimes I think when you push out programs incredibly quickly, the communication around the programs has not been as smooth as perhaps it could have been. And so that is still an ongoing challenge for the government. It doesn't seem to be able to give clear answers to very simple questions. And I know, we in the media are flooded with emails and Twitter messages and phone calls from Canadians who are worried and want to know what they should apply for, and MPs' offices are the same.
The advice I'm giving is apply for anything and see what happens. Apply for all of it and hope for the best, because honestly, you're right. It's all changing so quickly and the details are changing quickly too. Okay, I got to leave it there. It was a fast one, but I appreciate you being here from your homes. Before we go, be sure to subscribe to At Issue, the podcast, for extra content. This week, we're going to talk a little bit more about the cooperation and coordination we're seeing between the provinces and the federal government. Look for it on any major podcast app, our website, cbcnews.ca/thenational. For now, though, back to Adrian and Andrew in Toronto.
All right, so COVID-19 will and is hitting Canadians in all sorts of ways, in our health, our finances, and our relationships. And we want to hear your stories about what keeps you up at night. So here's tonight's Pandemic Diary.
Hello, I'm Zlatina Tileva, and I'm a mom in my 30s. I have 3 daughters aged 11, 10, and 4. What's keeping me up at night is the stress of our financial situation that we're in. My husband has a moving business, and right now, everything has been put on hold. We don't have any income and we have 3 children to feed.
Wow, look at your schedule.
We also rent in Toronto and we don't know if we should pay April's rent or pay May or what we will have money for at the moment. We have been completely caught off guard and I'm feeling very anxious, nervous, stressed, afraid, fearful, and I have no answers.
Still ahead on the National, when some child care workers were put out of work in Nova Scotia, they decided to spend their time checking in on folks on the other side of the age spectrum. Their story coming up.
Plus, the unlikely rock stars of the daily press briefing world, Canada's now famous sign language interpreters. We're back right after this. A sign language interpreter in Georgia turned heads today. That long white beard had some mistaking him for former Late Show host David Letterman. Now, he's one of many sign language interpreters who've enjoyed some unexpected celebrity. And as Eli Glasner explains, through daily COVID-19 news conferences, they are bringing joy and, of course, critical information to the public.
We really want to make a massive effort.
First, maybe you notice their gestures, then their expressions emphasizing the seriousness of the moment. Suddenly, sign language interpreters are...
My friend, you're a champion, you're a rock star, helping people in the deaf community.
You are becoming well known, sir.
This construction worker created a Facebook fan club to see if he was alone in his admiration of BC interpreter Nigel Howard.
People who haven't had the pleasure, what is it about Nigel that helps you right now?
It's just his body language and how passionate he is about what he does. He can't help but not smile when you watch Nigel doing his interpretation.
Now people are reaching out to Howard. His mother says her nonverbal son watches Howard and is learning to sign.
Brody, what do we say? Say thank you.
Nigel or Mr.
Charlotte Millington works with the deaf community and says what makes Nigel Howard stand out is his effective communication.
For example, when Dr. Bonnie is talking about social distancing, Nigel has a sign that has now become a very famous meme, which is this. I think every single person is very capable of understanding that.
Brenda Jenkins is an interpreter who was raised by her deaf parents. To the pride of her father, she's now sharing the Prime Minister's message. He remembers what it was like before sign language interpreters were required.
You know, the masses would have access, but we wouldn't have access to the information at the same time. You know, and I found that incredibly frustrating.
But the passing of the Accessible Canada Act changed that, requiring sign language interpreters at public events.
There's such a need in our community for more sign language interpreters, and so now that there is a presence, I'm hoping that our youth will see that this is a viable career.
A career providing joy and connections at a critical time. Eli Glasner, CBC News, Toronto.
How great is that? Next on the National, taking a moment to look after each other.
They're just tremendous. They're almost like family.
Our moment is right after this. With so many staying home as much as possible to help stop the virus in its track, we know some people aren't getting as much human contact as they crave, and that's really hard. So that's why staffers at a Nova Scotia YMCA who regularly look after kids now have a new focus. Their outreach is our moment.
Our childcare staff are reaching out to some of the seniors in our database just to see how they're doing.
It's really hard now staying home without that swimming. You expect it like when everything was good. You go there in the morning and you swim an hour and a half. And I really, really miss it.
I'm on my own. Any family that I've had here have passed away. And so it's been very comforting to have a number of phone calls.
There's been people that talk about knitting and selling things that they're knitting.
The feedback looks very positive. Lots of questions about when the Y is going to open and that they miss their friends that they've met at the Y.
She calls me different times and to see if I need anything or if we need anything picked up. They're just tremendous, almost like family.
So here's the deal. There are 8 of the staffers at the YMCA, Andrew, and they say they figure they've now made maybe 200 calls, and so many people are joining them because they realize it's, you know, it matters for the seniors, but it also matters for them. And some of the seniors are telling them that they've gone from being shack wacky to shack happy.
And I just love the fact that for these childcare workers, I mean, clearly it hasn't only been a love of children that's driven them, but a love of helping people who need help. That's become so clear. That's The National for this Thursday, April 2nd. Have a good night.